We're good. One more coffee before I get going here. Critical ingredient. We're good. Right on. Okay, morning everybody. Another one of my, I don't know how many I've done of these. 5, 4, 5, whatever. Russell Skeet told me it was week 85 of this right now, so he's probably not that far off, actually. So everybody kind of knows what's been going on with High River and with Cargill. I've got an enormous amount of feedback from residents and businesses and the media. It's giving you guys something to do anyways. But this issue with Cargill is a very complex issue. And just because the plant is now shut down does not mean the issue is contained or has all of a sudden disappeared. Coffee maker. So it needs to be spoken about. We need to have the conversation, but we need to do it fairly. And no, I do not believe that in the media the conversation is being handled fairly. There's just no question about that. It's very much one-sided, and it's not fair. It's not fair to Cargill. It's not fair to Cargill's employees, and it's not fair to the town of High River and all of us that are involved in this thing, because it's our community, and we are all in this together, and we're the ones that have to deal with it. So priority number one in all of this, of course, is the safety and health of the workers out at Cargill. No different than any other business or town or your home or anything. Talia, I got interviewed about the economy discussion. If you are not putting people and people's health and safety number one right now, you think the economy's coming back anytime soon? You got rocks in your head. You think just opening the doors right now is just going to make everything wonderful? I'm sorry. That's a very, very reckless and disastrous solution to any of this, and it's no kind of a solution. But this is a virus, and as Dr. Weiss was saying to me this morning, that had an hour and a half conversation with him this morning just to get up to speed, and we're working on just-in-time solutions on all this. There is not a one-size-fits-all for every community throughout the world on this. So we need to be constantly having the conversation and learning and looking at what's working, what didn't work. Is it kind of work? Does it fit here? It's unbelievable what's going on in High River. So back to the Cargill piece. We need to talk about this issue, and I also have, the role the community plays into it, and the role of Cargill workers as part of that community, as to how we all have to work together in order to get through this as best we possibly can. So number one, I want to go back and stress that this is not a Cargill pandemic. It's not a Cargill virus. It's everywhere. It's everywhere on Earth. Cargill, the virus came in just like it does everywhere else. So we have to be very, very careful on the blame game. And I'll go back to that. And I've had one long email that came to me just not cussing me out, but very much stressing that they wanted me to be on the blame wagon of Cargill. And I will not do that. I am not going to take one business out of this worldwide pandemic and blame them for everything that's going on. So it's unfair, it's irresponsible, and I just won't do it. And it's not the truth. And that's all I seek is the truth, and to provide you guys the truth. So the media end of things, we got to be very, very careful with that. And I stress to the media that there's a lot going on in this town that's very, very good work that's being done to protect everybody, and we need to be speaking about that. But at the end of the day, this is a community issue. This is not us against them piece. This is High River, and Cargill is a part of High River. They have been in this town for 30 years, 30 plus years. 30 years? 40 years? What, 89? Do the math. They have been very supportive of High River. They've been supportive. They helped us get the field house built. They're huge supporters of the High River Hospital. They do their own fundraising with their golf tournaments and stuff, all this kind of stuff. They put a lot of money back into town. The Cargill people, they live and they work within our community, and that's really what I want to stress, that we are all in this together, and we all have to work together to get through this. I'm going to stop there, but get myself in trouble. There are 2,000 employees that work at Cargill, and about 40% of these workers live between High River and Okotoks. Mainly High River, some in Okotoks, but 60% of them do live in Calgary, which is why you're seeing the issues in Calgary. But I really want to stress as to what Cargill is, because there's a lot of misinformation. I'm getting a lot of things that people just don't get the effects of Cargill and plants of this size in our community. And Brooks and JBS are dealing with the same issues out there too. So, but what Cargill does, 40%, and you think about this when you're in all the grocery stores that are around even just the foothills area, but 40% of our beef supply in Canada comes from Cargill. 40%. If you take in Brooks and the JBS plant as well, that is 70% of the meat supply in this country is what is produced out of these. And this is the critical piece as to why these people are so important and why we need to support them and keep them healthy, because they provide this for us. To put things into perspective for you, to understand what goes on out at Cargill, and Council had a tour back in November of the facility, so we know exactly what the conditions and what that plant looks like, and it's the volume they deal with, and to process that much beef is unbelievable. But Cargill processes 4,500 head of cattle per day. And they do this 5 days a week, sometimes 6 days a week, to try to meet the demand. Most of their product is distributed throughout North America. A lot of it goes into worldwide markets as well. But you go back and think about 4,500 head per day. So this is a little weird analogy, but it might help people understand the volume. If High River was a feedlot, you clear this town out in 3 days. I know it's weird, but I'm trying to put it in perspective as to the volume that goes through there. So you start to understand the volume that these people work on and how important our protein supplies are to us. So the byproducts that come out of the plant, it's not just the steak that you grab at the grocery store, the dog food, the animal nutrition byproducts that come off of it, the plasma. I know the group that does the plasma research, that all the plasma gets shipped down to Texas to a plant, and they do cancer research, and it's used for hundreds of different things. Bone meal, your fertilizers, all of this kind of stuff, the margarine, if you eat margarine, gelatin, all these things are byproducts. It's not just the steak. So you got to start to understand the scope of what goes on there. The demand that we require, our meat supply, is unbelievable, because even at 4,500 a day, and that's Cargill, JBS does, I think, the same volume, 4,000 to 4,500 a day. So Between a 3-hour drive here, we got 9,000 head a day to meet the demand we want. It's mind-boggling. So talking about the shutdown and what the shutdown means, and we have to be fair and talk about the ripple effects of the shutdown. I know there's lots of you that I've heard from, I got the emails, and that just want to get the corporate man, let's get that guy, right? You want to blame somebody, you want to get somebody. The ripple effects of this are endless. They drift so far. When you look at Cargill itself, the Cargill employees that are drastically affected by this, more than probably anybody, the Cargill subcontractors that are out there, the truck drivers, the trucking industry, the finishing feedlots that we have around town, the backgrounding feedlots, if you understand the market. I worked in all that stuff when I was younger, so I got a pretty good idea as to what it's all about. And then from the feedlots, you go down into our local large and small ranching operations that all feed back into the chain. That's what gets us, and that's what feeds the 4,500 a day. So you start to understand all the people that are involved, and if you're going to care about the Cargill employee and keep the Cargill employee at the top of the list, that's fine, and that's great. But there's also a lot of other people that are affected by this, okay? Cargill's a little, it's the health and safety that we're going after right now, but just want to make sure everybody understands the ripple effects of all of this. And I want to say one thing to the union rep, and I want to stress this, that this is not just a matter of we can all do without a burger for 2 weeks, which was what the comment was. This is so far-reaching that it's unfair to just say that it's isolated to me not having a burger. I'll leave that rant alone. The other piece that I've heard is, well, this is good. Our local butchers will pick up the slack. I've told you the numbers, 4,500 head a day. You know the size of the plant that it takes to process 4,500 head a day. Foothills and Burghart's in town. I can't speak to it. You know the operations. So how critical this community of the Cargill worker is to this town is unbelievable. And we're starting to see how important it is to care for and make sure these people are supported. From Cargill, you're looking at Tim Hortons now, so that we can get our quick and easy and cheap coffee in and out and gone and done. Same with McDonald's, A&W, they're all shut down now. It's far-reaching, and this is why we have to keep these people safe and make sure they've got the care mechanisms so that we can provide them the support and to be able to get through this. So might come back to that one, but we'll leave it for now. Got to be careful on getting on a big old rant. So next piece I want to clear up is the town of High River as a municipal organization and how we fit in with Cargill. Been a couple of comments that people actually that live in this town for a long time obviously haven't driven north up Highway 2A to understand where Cargill is actually located. Cargill is not located within the town of High River. It's a few miles north. So it is located within the Foothills County, previously known as the MD of Foothills. If you don't, not paying that much attention, but. So the taxes that Cargill pays are paid to the MD of Foothills. Our palms are not greased by by Cargill's taxes, okay? That comment is just, it's ignorant and uneducated, and you need to do your research before you make a comment like that, please. What Cargill's role in it is Cargill uses a lot of water for that processing down the High River through our water treatment plant. We treat that water and we distribute that water to Cargill. We do not sell them the water. They have their own license for the water they use. Ours is strictly just treatment and distribution. We treat the water and we put it in a pump and we send it north, just like we do all of the businesses up Highway 2A. Not just Cargill. We feed water there and we feed it south down to Cayley. So I just wanted to clarify where we sit in this thing. A lot of people don't understand that, but now's the time to clear it up, give you the truth. So next piece I want to go to is the timeline as to how this all progressed and where my involvement came in, because there's a few pieces and a few emails that I've gotten. Why didn't Craig shut it down? Okay. The town of High River has zero jurisdictional control over the operation of Cargill. Okay? So we shut the water off to them, like people think we can. Well, that's a whole new mess. And it affects everybody going north. So think about that for a second. So where my timeline was, over 2 weeks ago, 2.5 approximately weeks ago, I started phoning Cargill just out of curiosity, knowing what the plant was like and everything, where you guys at with it and everything else. Dale LaGrange, the manager out there, got back to me and told me at that time they had, that was, I'll give you the date, April 7th. They had 6 cases, known cases at that time. Everybody knows how fast that progressed once the testing started to really take hold. And but I want to commend Dale because he was very, very good, and we either spoke or there was text going all day, and he was keeping me 100% up to speed as to what was being done out there, the precautions that they were putting into place, divider barriers, and for those Cargill employees, you've all seen this and you know what's going on out at the plant. But he sent me this PowerPoint as to what they were doing to put dividers in the cafeteria and all these other areas to try to keep worker safety. The comments that it was still shoulder to shoulder, I don't know, but actually I do know because I have pictures. There's dividers in between them. So they were doing a lot to try to keep the safety of their employees at the top of the list. But every conversation that Dale and I had, there was always some form of, if it came to a shutdown, what does that look like? And where does that fit in? Is it a solution? Does shutting down the plant change anything? All that. We were constantly talking about that. From there, then, as I spoke about the last video, Dr. Weiss gave me a call 2 Mondays ago now, I guess, on the 13th, and started explaining the plan that they had and what they wanted to kind of do. Then that's where we started to pound the table to get the attention of the Ministry of Health, and everybody knows that story, which worked fantastic. But because I tell you what, the resources that have come into this town, and I have to give them the kudos that they have just done a full cannonball into High River with the resources. And I had the honor and the pleasure of having a phone call directly with Dr. Hinshaw on the weekend, and shared a lot of ideas and heard thoughts as to where we need to go and what pieces they were putting into play in High River and the resources that were coming to us, and started to make me feel a lot better. But as Adam has told me a number of times, he said it's unbelievable. This is the first time that the Ministry of Health and AHS and the PCN, the Primary Care Network, with all the doctors, learning all the acronyms, that all these people are working together right now. And it's exciting for these guys to see it all happening and communicating. It's fantastic. So I'll go into more about what's actually happening on that level. The other piece that I want to talk about going back to our involvement and where I've fit into this thing, is the CBC has reported on a letter that I received from Cargill worker. I received it through my Facebook page and screenshots of a letter requesting, me to talk to Cargill or pressure Cargill into a shutdown. So it was also CC'd to CBC. So CBC's been questioning on it, and immediately once I got the letter, I replied to the gentleman that sent it to me and told him, yes, we have been talking to Cargill for a week about this and what that looks like and what pieces are in play with a shutdown. And he was very grateful that we were even talking about it, and that was his words, that thanks for talking about it and bringing it up. Now this letter was just a letter with the request of me getting involved, which had already happened for a week, but then it had a list of 267 names and phone numbers attached. There's no signatures on it. And he was clear that not everybody on the list are employees. So it wasn't an employee specific. It was just a list with a whole bunch of names and phone numbers on it, not a single signature anywhere on it. So it does not fit into a legal petition of any kind that the town of High River and it can do anything with. I don't have time right now to phone each individual to ask them if they actually wanted their name attached to this thing. So I sent a message back. I provided the individual my direct cell phone number and said, give me a call. Let's talk about this. I want to know where your concerns are, and just have a direct conversation outside of the letter. So that's where that went. To date, the response was, okay, Mayor, thank you very much. I have yet to receive a phone call from the individual. So, and that's fair. That's fine. It's fine. That's his choice. So, but just to be clear as to where that went, and that's the truth of it all. So, again, the town of High River has no jurisdictional control on a shutdown out there. So we can have the conversation, be throwing ideas back and forth, but that's about it. So there's the thing. There's the history. It's the honest truth. If you don't like it, you can shred it and put it in the garbage. That's fine. Or you can start to have the real conversation amongst your groups and a fair and open conversation about the whole issue. So where do we go from here? As of last night when I checked, the April 22nd numbers, what's today? 24th? 3rd? Okay, so I haven't got it right. It's Thursday. April 22nd numbers. 334 cases in the High River zone. And I've had emails saying, well, how many are actually in High River? Like, but you can just say the majority of those are in High River. Like, there's no, there'll be a few that are maybe scattered around, but let's just say all of them are in High River. That's fine. You also have to say that we know that 334 number is low. It's a few days old. So, you got to keep all this in mind. It takes time to test and report and then put it on the website and everything else. So we've got to be very, very aware, and I've been stressing it for a month now as to how seriously everybody has to take this. And if you're specifically looking at that number, and that number is serious to you, your actions have to be very, very serious as well. So talking about the support systems, so Alberta Health Services, the Ministry of Health, the GOA, that's what we're doing right now. It's what all the last week was putting these pieces into play. Dr. Jia Hu is the lead from AHS. And this guy, I'm telling you what, if we need somebody directly in the town of High River, it's this guy. You want a guy that works. Like Adam and I are just floored at the involvement. I can text him any time of the day. He answers within seconds. I get the information. If I have concerns about something, we phone. He phones me back. Like it's just on a daily basis that I myself am in direct conversation with Dr. Hugh, as well as all the healthcare workers. They have access to him as well. So there's so many other people, but Dr. Hugh is critical, and I know we got the right guy in place in this town to help us through this. So the primary care network, that's the critical piece, of course, with all our doctors. They've got the communications and the COVID hub set up that's, I understand, is working very well in monitoring and communicating with these individuals that need to quarantine or isolate. So that's working very well. Our immigrant services, I was involved in a phone call on the weekend that had all the immigrant services, the CCIS in Calgary, FCIS here in High River and Okotoks, the MOH, AHS, all the acronyms are working together. And you know, so with what we're looking for and what we need in High River, we're always looking for more answers and more ideas, but we're doing very, very well right now. So how the quarantining is working, that's being worked on right now. The GOA is doing contracts with the hotels to hopefully have the positive cases where they're somewhere safe and away from infecting other family members, can go and isolate for the 2 weeks and be supported and have the mechanisms in place and make sure that they're safe. So those pieces are being worked on right now, and it's a complicated thing as well, but it's happening. So now I want to get a message directly to Cargill workers, not just Cargill workers, but anybody that is COVID positive, as to your role in this, because it's critical. The plant shutdown doesn't do anything unless we have quarantining taking place for the 2 weeks. So that is where your critical role of getting the plant up and operating again and getting people back to work, that is a critical piece for these people. They like to work, and not working kind of drives them nuts from what I've heard from a couple of them. So we got to make sure that they're home, they're taken care of, they've got the resources they need, and but your role is very critical in making sure you are quarantining, isolating, whatever word you want to put on it, but you got to stay home. If you have symptoms, we absolutely need you to get tested. If you are symptomatic, we need you to get tested, and that's phoning 811, phoning the other number. I meant to grab that one. I can grab it off my phone quick, but making sure you get tested, because if you get tested and if you are positive, we have to be able to do some tracking as to who else you've been in contact with to try to keep these clusters isolated and keep them contained as much as we possibly can. That's the success that's going to come out of this. If you need support while you are in quarantine, please, number one, if you need medical support, just call your local physician or call 911 if it's that serious. Of course, that's there. You can phone 811, but your family physician is probably your best mode of conduct if it's just questions about medical conditions. But other support systems are in place with CCIS and FCIS. Most of these workers have relationships with those organizations, and very easy to connect with them, and it breaks down the language barriers and everything else that need to take place to make sure that you are taken care of, because I'll go back to it time and time again. You are extremely important to our lives in High River, and we have to keep you safe and healthy and make sure you have the resources that are available to you. One piece. If your employer is asking you to return to work and you are not comfortable in doing that, or you think there's red flags with that, you must contact AHS. We must know about these things. We have to talk about it, and we've got to make sure that everybody is taken care of. And I've been sent a couple of concerns and started working through those this morning, and there's AHS guidelines on it and everything else. But if you got concerns on that, just make sure you're talking about it. Do not be fearful about talking about it. It's very, very important so that we all stay on the same page with this. And I'm also asking for the whole community. We got to be patient with this, and this isn't a shut down Cargill and the problem went away. It's not that easy. So we absolutely have to be patient with it. It's going to take us a few weeks to get through this. We all still have a critical individual role to play in this thing. Go back to the hand washing, the social distancing, the masks are still a thing. So do your own research and make sure you're doing what you are. I'm glad to see that all healthcare workers are mandated to wear this stuff now. It's been critically important that that gets taken care of. So, but please just be patient. We've got the resources in play to help us. And we are starting to see, when Dr. Weiss and I were talking this morning, we're starting to see some success as to where we're at with this. So let's start with second floor at the High River Hospital, which was our number one biggest concern that when it was the first case that we heard of a positive staff member testing positive up there. So, and then it's gone into a few residents as well. And from what I understand, yes, we had the one gentleman that passed away from it, which is very, very unfortunate. And there's 6 or 7 other residents that are COVID positive. But in the last 5 days, there hasn't been any new cases come. So that is a very positive sign, and we commend the work that's happening up on second floor and throughout the High River Hospital to contain this thing. So no new cases in the past 5 days on second floor is very positive, but there are active cases up there, and we feel for all the families. And I'm telling you, I'm in direct communication with one of them, and those of you that sit out there and say, well, this is only a virus and it really only affects the elderly and those with pre-existing conditions, you're full of shit. And I get frustrated when I hear that, because the ripple effects of that are devastating to these families. These individuals are struggling. On second floor, I think they're still allowing family members, if it's critical, that a family member can go in and see their family member, loved one. But if you're looking at a Mackenzie Town facility, I know firsthand, you don't get to go see that person. So these people are sick. They don't have their family members around like they usually would. And then you start to go into the other effects of if they pass away. And will there be a viewing of anything afterwards? Limited number of people, if there is. And then the fact that no funeral services. And I'm sorry, but I know exactly what not having funerals does to your community. And this needs to be thought about, and it needs to be spoken about, because it's not just all of their old people that are going to die within a year or two anyway, so what's the big deal? And I'm serious, that's the conversation that's taking place. Anybody that listened to 770 News yesterday with Rob Breckenridge, the mentality is just mind-boggling to me. We need to take care of these people, we need to take care of these families, because the effects of this, of what's happening, is devastating on everybody, and it's beyond difficult. I'll leave that there. So that's second floor. Going to the Medicine Tree Manor. I spoke to Lorin this morning. There are 32 staff members, none of which are positive. They do health assessments twice a day, and they're all checked every day and making sure. And the second, if any of those workers even have a runny nose or a sniffle, they're home. And there's just no questions there. Currently, no staff members are symptomatic, so everything's safe with staff over there. There are 104 residents over there, none of which are symptomatic or showing any signs. So that is a success as to where we're going, that we're keeping that one isolated. But there is a message that Lorin wanted me to share with you, and that is concerning Soderberg House, which is right beside Medicine Tree Manor, and that's they're still congregating. And they're still congregating in groups of 8 or 10. We can't have that, especially in these seniors facilities. So if you have a family member that's in there, please help them communicate to the importance of the social distancing. And the lodge residents, yes, they're allowed out, and to go for a little walk or something, but you still have to keep the social distancing. You can't be sitting at their feet and talking. You have to keep the distance. All the same rules apply. So please speak to your family members that are in there and stress the importance of what's going on, because the last thing we want is anybody to get sick in these facilities, or to be brought in from outside. If the staff members are all being responsible and there's success there, then we need to do that. If you're visiting with loved ones, you need to do the same thing that the staff members are doing so that we don't bring it in from other ways. At the Seasons Retirement Center, I wasn't able to hook up with them, but yes, we do know that there are a few staff members that have tested positive or related to the Cargill situation. Those people have been told to be in isolation, but currently there are no reports of positive cases or symptomatic residents at Seasons, which is again very, very positive. And we have to keep it that way. We've got to keep doing this work to keep that. But I'll have more, try to do an update from these 3 facilities every week. So I got stuff everywhere, you guys. I got all my notes from Dr. Weiss's conversation this morning. Like, this is kind of stuff we're trying to keep going. So I want to go back and kind of start where, now that those are all dealt with, I want to start with going back and number one, thanking all of our healthcare workers. The town of High River, in our meeting the other day, we proclaimed May 1st as High River Healthcare Appreciation Day, I think it's called. Thank you. I voted on it, so I should probably know the name of it, but it's a rah-rah for all our healthcare workers, and I don't care what level you're involved in healthcare in our community. You're an absolute hero, and the work you're doing is just mind-boggling, phenomenal. Again, as Dr. Hinshaw said the other night, we absolutely, and Premier Kenny is stressing it too, that we cannot take our foot off the floor. I love it. On this thing right now, because it is just because we're seeing signs that are very hopeful. We are still maybe at the end of the first period. If you're relating it to a hockey game, we might be at the end of the first period, and things are looking good. But we got a little ways to go to win this game. So again, hand washing is critical. Social distancing is critical. And please, just because it says 2 meters does not mean you have a tape measure attached to yourself that says you have to come into 2 meters. I can talk to you from 12 away. It's real easy. That's what we used to be. That's what we used to do beforehand. Why is it now that everybody's got to come right into that 2 meter barrier? Even my 5-year-old son is telling people to back off. So it doesn't have to be 2 meters. Give it 12, give it 6. We can do that. So it's mind-boggling that human beings, we're just wicked. And thanks to, I'll come back to that. Stay at home, focus on High River, make sure yourself, take your own responsibility very seriously, make sure your family's safe, make sure your neighbors are safe, and this is a community piece. All of us, regardless of where you work, regardless of where you came from, I don't care. This is High River, and we are all in this together. I'm not going to go into happy trails and everything else. What I've seen, people are doing a pretty darn good job of making sure things are continuing to walk and all that kind of thing. So going back into more town High River operations stuff, I just want to little update on, we're halfway through April now. May is always our emergency preparedness month, and that includes flood, of course, weird, eh? So the bags on 12th Avenue are being replaced. Be respectful of the workers. They're getting those things in place because the Southwest Berm construction, we awarded the tender for that construction project on Tuesday. So that's all proceeding forward. We're flying on that one. But it's not going to be complete by June, so we need those bags in place, and that's the way it has to be. And that project, yes, it does include building the berm. It also includes rebuilding all the underground utilities, deep utilities, water and sewer lines under 12th Avenue, and it also includes rebuilding the whole road. So that'll all be taking place. So I'm not going to get into a timeline on that. It'll start this spring, and hopefully everything will be buttoned up by this fall. But you know how construction in this country works, so I think you're getting a date out of me of, you're not going to happen. The mental health component is still largely in play with everybody, and making sure that if you need help, and I tell you what, the one thing that I am seeing in High River changing right now is, and at a high level, is the anxiety amongst all of us, regardless of the level you're at. It's bombarding us, and it's very important to take a break, and take a break from the media, take a break from your cell phones, just put it away. Like Lindsay, she hides mine. She made the mistake, she put it up in the liquor cabinet the other day. That was a very good idea. But hide it somewhere because you just need to take a break from all of this stuff, separate yourself, and keep your own mental health in check, and be very aware. And if you need help, talk about it. The resources are there if you need to make a phone call to get the help that you need. So all of our town services are still fully operational: water, wastewater, fire, police, garbage, recycling. All of that stuff is in play. I don't think I've missed. Oh, I'm sure I missed, because by the time I started this video to what's happening now, it's changed. That's how fast it's going. But I want to make sure I'm not missing anything before we go into questions. I guess one big thing, I want to talk economy. There's one critical piece on this economy discussion that's very, very important right now, and that is to the employers, and how you are handling employees that are related to the pandemic, whether through Cargill or any other way. You have to be very, very aware and watching out for your employees, and making sure that you have the supports and the ability to allow them to stay home for the 2 weeks if they're tested positive, of course, but if they're potential, or if they are connected to any of this, that conversation needs to be handled, and they need the space and the ability to isolate, because if we don't, it's just the economy is not going to come back online anytime soon. It's just going to keep on spiraling. It's just, make up all the theories you want, but that's just the reality of what's going on. So I like to deal in terms of reality. So it's very, very important to make sure that your employees are taken care of. So I'll end that. Again, my last message: we are all in this together. This is not an easy thing to go through. I stress to the media to be very, very careful in what you're doing. And this is a community piece that affects all of us in High River, and it's not isolated to one company. We have to be fair, and we have to be fair to the employees and our whole community. So open up the conversation, start talking about the whole thing and not just one piece of it. It's a complicated issue, but to the rest of the town of High River and our surrounding neighbors through the Foothills County, Okotoks, Nanton, out to Vulcan, and Black Diamond, Turner Valley, Longview, we're all in this together, and we all got to be on the same page to get through this. So it's our community. Questions? What do we got? Probably not one, hey?
There's a lot of great support coming through for you. So just so you know, lots of positive comments coming through.
Thank you.
And a question about grocery stores, actually. If you could just remind people, what are the rules in grocery stores? How can we keep the workers safe and keep each other safe?
Yeah, the grocery stores are they're the one essential service that we have to access, and it's very important that they're safe. And in High River, what I'm seeing is pretty good adherence to what's being said. I would like to see, personally, I'd like to see employees wearing masks, but I think they are following the health guidelines. When I was in the grocery store the other morning, I was encouraged to see the number of customers that were wearing masks. And I want to speak to the mask thing once, because if there's one thing that I think that we could have done better is stressing the masks when we are out in the public, and stressing it in our healthcare facilities. Like I said, we're learning along the way, but we have learned how critical masks are for all workers in healthcare facilities. And it goes down that when we're in grocery stores and passing each other in the aisle, there is transmission that can take place through the air. There just is. It doesn't meet guidelines of an airborne illness, but take those precautions. And yes, it might just you protecting others, but the other person is wearing it protects you. So I'm kind of big on that one. You've heard me and talk about it, and there's lots of back and forth on that one. But I think it's not only the grocery stores themselves; it's how we're conducting ourselves in there as well. So you have concerns, definitely talk to the grocery store managers and get what their policies are. That's their, a lot of it is their gig. And I'm encouraged to see what's happened over the last couple of weeks in these facilities. So like I said, got concerns, talk to the grocery stores directly.
Are employers supposed to tell employees about closures? So like McDonald's, Tim Hortons, so just all employers, are they supposed to be?
Are employers supposed to tell their employees that they close business?
Or just in general, I think it's a more general question, like just to tell them about all the closures that are happening.
Say that again, sorry, I'm going to get this one clear.
Are employers supposed to be telling their employees about all the closures that are happening? The example is McDonald's, Tim Hortons.
Yeah.
It's on them to do it.
Yeah, absolutely. It's on the employer. So if the employer is closing down the business, absolutely, it's up to the employer to communicate that to their employees and to the community, in my mind, because it doesn't take that long to notice it. They're closed. You can't go in it. So, but yeah, communication is just so critical in all this. And I'm a firm believer in, yeah, the conversations might be hard and the information might be tough to hear, but you have to give the real information, and you have to be truthful about what's going on. So people can make their own proper decisions. It's just, it can't happen any other way. So yes, communication between the employer and the employee is critical.
Yes. One more came through. If you know if there's any supports or will be supports in place for grief counseling for Cargill employees.
Yeah, so the grief counseling for Cargill employees on any level, and through your CCIS or through FCIS, that's your direct link to all those support systems. That's what they're there for, and those pieces are all in play. And it's like I said, back to the mental health piece, and grief is part of it. just to connect with those individuals or connect with somebody, that your family physician, or connect with them, and they'll get you to the right people. But I know FCIS and CCIS have all those resources available to you.
Do you know, and this is the last one, do you know if High River Hospital has the capacity to treat and maintain the load of cases that are in town?
Yeah, so that's a great question on High River Hospital's capacity to deal with this. So the answer is yes, because 90% of these cases can be monitored virtually. It's just a matter of the individual quarantining at home, staying at home, and recovering. That's 80 to 90% of these cases can be monitored that way and can be handled that way. Of the other 10%, the emergency at High River Hospital is available. The capacity is there because if it's critical and it's more than just what the High River Hospital can deal with, all these cases are going to either South Calgary or the foothills at this time. I think it's just the two primary locations for it. So the serious cases are going to Calgary anyways, which doesn't take capacity out of our existing hospital. So I've been told that the ER is from normal rates. We're still well under normal capacity within our ER. So yes, we have the capacity to handle it locally, and serious cases can be taken to High River for more intense care if required. So that's it. That's good for questions. You know how to get a hold of me. I'm here to tell you the truth. So it's the only way we're going to get through this, honestly. And some of you, it might fit your conversation. Others, it might not. And that's not my concern. My concern is to give you the information. You guys can have your own conversations and come up with your own solutions to it. But again, this is our community. We're all part of it. We all got to be on the same page to get through this. Foot to the floor, rock and roll.